I started in the health information field in high school when I got a job working as a file clerk in a medical records department. So when I went to college, the natural thing was for me to have a part-time job working in the same field where I had some experience. And I was lucky enough to be able to fit into a lot of different part-time positions within the hospitals I worked at. So I learned a lot of things like tumor registry, which is now called cancer registry, I believe. I was exposed to coding. I was exposed to what they called posting at the time. I would fill in as a transcriptionist, even though I wasn't that great a typist. If they needed somebody on the weekends, there I was. So I had a lot of experience doing things like that. When I graduated from college, I had a bachelor's degree in liberal arts, which is really incredibly useful if you want to do something else. So I stayed in the health information field and became a coder, which I loved. It was a great way to learn everything there is to know about medical records. And from there, I continued to work in reviewing medical records. I worked in the Medicare program as an auditor and eventually as the head of the quality improvement organization for the state. So eventually I came in the back door and I had gotten my my 2-year degree in health information along the way. And then I decided to become a registered health information administrator, sort of also along the way. And I was so into learning at that point that I got credentialed in quality and all sorts of things like that. But I love health information, and it's pretty much been what I've done most of my life. Kind of a typical day is to go into the office and put out fires, things that may have occurred overnight, questions that people are rushing in with right away. One of the main things that I found very helpful in whatever position I've had, whether it's in a nursing home or in a hospital, is to go back and see what kind of admissions happened yesterday. And one of the reasons for that is sometimes it's really easy to get patients confused, and you wind up with a situation where two patients' records are combined or patients' records that should be together are separate. So I've always spent a little bit of time making sure that the admissions process was followed correctly. In some of my positions, I have then had a stand-up meeting with other managers, and we stand up so that we can't talk too long. But basically what we do is keep each other aware of what's going on in the facility, which is very, very helpful, because if you know that the beds are getting too full and you're not going to have too many more admissions, you can plan for that. If you know that there are going to be a whole lot of discharges that day, you can go back and tell your staff, or you can yourself go back and start working on that. In a number of my positions, I have gotten calls throughout the day about codes that are needed for ICD-10 codes that are needed for records. And in nursing homes, that's critically important, because you are paid according to sort of like a DRG, but not quite the same. You're paid according to the acuity of care, the services that are rendered, and it's very important to make sure that you're documenting concurrently what the patient has, changes that have occurred, things like that. One of the things that I would probably point out that I've done, no matter what my job is, whether as a consultant or whether I was auditing for Medicare or working as a coder, what I learned was the first thing to look at is the physician's orders. And that is because if you want to know what's happening with this case, you want to know what the physician behaved as if he or she was treating. And that's been really helpful, because sometimes people just write whatever they write from memory. You know, this patient has CHF and hypertension and blah, blah, blah. And they completely forget to mention that the patient came in overnight, desperately in need of surgery. And when you look at physician's orders, you get a really good glimpse. I guess that would kind of tie in with what's my piece of advice to people is, you know, great source of information is physician orders. Some of the other things that I've done is oversee, or I would do on a normal day, is oversee contacting physicians to make sure that they have made all entries or signed all orders or done whatever needed to be done to complete a record. But also, mostly what I found is being available, because no matter what, people in your own department and people in other departments and lawyers' offices and insurance companies all have questions. So I would spend a lot of time on the phone every day. One thing is, from an early time, try to figure out if there's someone you know who is willing to take you on as a student, as an intern or extern. As a graduate, I would always take on just about any student that was offered to me. I would tell them in advance what was going to happen on the job and what they would do. But I would give them a learning experience that sort of got their foot in the door. And I can't promise this would happen to everyone, but when I was working in one particular hospital, it turned out that just about every other student that I took got a part-time job with me, because something turned up, and they might start out as persons who would file loose reports or who would help get records together for insurance companies or for audits or things like that, or who would check to make sure that everything scanned into the electronic record was accurate and was readable. But I would hire people because, heck, I already just, let them do some work here, so I knew what they were doing. It's critically important. Don't be let down when you are getting close to graduation and you see that you need experience to get the job, but you basically need a job to get the experience. There are so many places that you can, step in and say, let me just give you some help, and kind of work your way in sometimes to that. The hardest thing, I think, is getting a position as a coder, because it's hard to train a coder. But if you can work your way into a physician's office and help out with, getting records prepared or doing release of information, things like that, you've got your foot in the door. And if an opening comes up, you're a little bit ahead of everyone else.